Hey guys, it's Kelly with Kari Health here. So I am seeing a few patients starting to come in with allergies and upper respiratory stuff. So I want to spend a few minutes just chatting with you about the differences in the different types of upper respiratory sinus infections, viral versus bacterial. I know this is a big issue with providers. People are hesitant to prescribe antibiotics, and by that I mean providers were hesitant to prescribe antibiotics when we think that it might be a viral infection. And the majority of upper respiratory sinus infections are viral. Please hear me when I say that. Because a viral upper respiratory infection or viral sinus infection will not get better with the use of antibiotics. Antibiotics treat bacteria, not viruses. We just, as a culture and as a society, have recommended the use of antibiotics way too much. We have handed them out way too much as providers, and this has led to multi-organs or multi-resistant organisms. We have vancomycin resistant organisms. We have so many resistant organisms that there are times when it makes it very difficult to treat patients because they have such a resistant organism that we have created by handing out antibiotics. So, how do you know if you have a virus or a bacteria? First, go see a provider if you're unsure. Just go, okay? Two, if your symptoms come on suddenly, like one day you're fine, the next morning you wake up and you are not fine and everything is wrong. Viruses love to sneak up on you, and you will be okay one minute and terribly wrong the next. All right? That's usually a viral infection. If for some reason you get sick and a couple of days have passed and you start feeling better and life is good, and then the next day you are suddenly worse again, or you're double worse, you probably have a bacterial infection. If your symptoms last longer than 7 to 10 days, we as providers assume that it's a bacterial infection at that point, and we're going to treat you with antibiotics. If you start to run a significantly high fever, something greater than 102, if you have sudden severe pain in your face or in your head, if you have double vision, difficulty seeing, if you have confusion or a difference in your mentation, like your cognition has changed, you notice swelling or redness around your face or your eyes, like you're noticing facial edema, what we call facial edema. You have a stiff neck, like you can't touch your chin to your chest like this. Those are all reasons to think that something else is wrong and you need to be seen immediately, or that you might have a bacterial infection. If you think for any reason that you meet any of those criteria, then those are all reasons for you to be seen, and all reasons to think that you could have a bacterial infection requiring the use of antibiotics. The other piece to that is whenever you get treated for an acute sinus infection and we think that it's viral, we're going to treat you with over-the-counter, usually symptomatic medications, meaning we're not going to give you an antibiotic, we're going to treat the symptoms. So we're going to give you things that treat your symptoms, medications to treat the fever, medications to treat the muscle aches, medications to treat the congestion and the runny nose and the pressure in your ears and the sore throat and the cough, okay? But we're not going to give you an antibiotic because antibiotics do not kill viruses. When you meet those other criteria that I just mentioned, then you qualify for an antibiotic. Now, I've had some people come to me and say, yeah, but when I got the antibiotic, I started feeling better. Well, that's because a typical virus runs the course of about 5 to 7 days. So when you started taking the antibiotic, you were probably at that 5 to 7 day mark, or you started reaching that 5 to 7 day mark. So it was kind of already at the end of its life anyway. So you kind of already got to the point where you were reaching that time. So it's kind of both. And I'm happy to have a conversation with anybody to discuss those things. And I'm not saying that everyone has a viral infection when it first starts out. There are legitimately people that start out with a bacterial sinus infection. And there are certainly times when that happens, like those criteria that I just said, that suddenly high fever, that sudden onset of facial pain, that swelling behind the eyes. Those are all reasons to be very, very concerned. But But most of the time, what we see is that upper respiratory infections, sinus infections tend to be viral in nature. So if you're ever wondering why when you go, we don't want to give you an antibiotic, that's why. If you have any questions, please feel free to reach out to me.